Same thing, working more that SI joint. And we're just going to start pumping those discs. So this is going to help pump fluid into those discs, open up those joint spaces. Hey guys, Dr. Mike here, Oak Brook Medical Group, Oak Brook, Illinois, and I'm here with another one of our wonderful patients, Amir. So Amir has been with us now a couple months, been working on low back pain, sciatica type stuff. So he's been through a ton. He's actually going to tell you a little bit about his story, but he's been consistent. He gets in here, he does his rehab, he works hard, gets his adjustments constantly, and he's actually been doing a little bit better. So I know, like I said, it's been a little bit. What kind of just tell him briefly what you went through?
Yeah, so I've been a nurse for about almost 11 years, so I've always had like issues with my lower back, and then, finally went to a doctor and got it looked at, and turned out, I had a herniated disc and some facet joint arthritis, and I've had injections. I've seen 5 or 6 different doctors that all kind of recommended injections and surgery, and I found Oak Brook Medical Group, looking online, and it's been amazing, and I haven't had an injection now in about, 6 months.
It's been a while. Yeah.
I love the aspect of it here. I mean, PT stretching, and I get to see the amazing Liz, the nurse practitioner, get some trigger point injections to help with the pain, and then you get a massage, you get everything kind of into one thing, and it's amazing. I truly recommend it to anybody dealing with back pain, any type of arthritis, or any type of musculoskeletal pain. This is the place to be for sure.
Yeah, and like I said, it's all out of what he's done too, because he's stuck with it. He's worked hard. I mean, at one point you came in and talked to me like, hey, they're talking about doing a fusion. You know what I mean? So we've been able to push all that off. He's getting better. He's back to working out, doing all these things. So today we're actually going to walk you through his adjustments, show you what we've been doing on him, and then go from there. All right? Face down, sir. All right. So come on down toward me just a little bit there. So like Amir said, we're talking about some disc issues. A lot of patients ask about sciatica. Is it sciatica? Is it, piriformis syndrome? Is the disc involved? This is one of the treatments we do for disc issues. This is called flexion distraction. So we get to open up these disc spaces, and it's kind of, in a way they talk about pinning and stretching with PT. So same idea here, but now we're going to get into that low back. So lumbar spine, we're going to pin that vertebrae down, drop into a flexion, and we're just going to start pumping those discs. So this is going to help pump fluid into those discs, open up those joint spaces. And the whole goal for this is, open up the space, getting him loosened up nice and relaxed so he can get into his PT and his rehab. And he's able to work a little bit harder to strengthen everything while he's out there. Perfect. Couple more here. And this is even just easier to move on here. Remember when we started doing this, it almost like fought me dropping down. So, all right, let's bring that back in. So, if you guys have been watching our videos, there's lots of different ways we can adjust the spine. So, Amir, we kind of do a combination. We're going to do the drops and that side posture, working on the low back and the sacrum. So, starting with those drops, working those hips and that sacrum, bring that side up. Good. Beautiful. On your side, sir, face me this way. Excellent. So this is that side posture. We're going to start working right at that L5, S1 area right there. Let this roll. There it is, other side. Good. Come here. I'm going to bring you a little bit closer to me. Good. Same thing, working more that SI joint. There it was. Face up, sir. And then just because we have that low back issue, remember that all connects into that thoracic spine too. So we're going to work in his thoracic, just do a little anterior bear hug. One more. Beautiful. And then stretch you out a little bit more here with those hips. Open everything up nice and relaxed. Beautiful. Come on up. So if you guys know anybody you've been dealing with, everything that Amir just talked about, right? give us a call at the number below. If you're watching on YouTube, hit the notification bell, like, follow the page, Facebook, Instagram, like and follow, and we'll catch you guys on the next video.
You guys are awesome. Thank you so much.